Hello everyone, my name is Emma. I am here to talk to you about Peplau's theory. In her theory she identifies 6 nursing roles and 4 phases of the nurse-patient relationship. Let's first discuss the roles. It is important for nurses to know what roles they are cast in so they can understand what patients expect from them. Although Peplau identifies 6 specific roles, she recognizes that nurses take on many more roles. The stranger role is when both nurse and patient are meeting for the first time. It is important the nurse is non-judgmental, meets all basic needs, and develops trust. Hello Mr. B, I am Emma. I am going to be your nurse today.
Oh hey. I want to see the doctor. No offense but you can't do much to help my pain.
Well Mr. B, I am here to help. First tell me where you are having pain and then we can work together to make you more comfortable. In the resource role the patient looks to the nurse for knowledge. For this role it is important for the nurse to stay educated and on top of her skills.
Nurse Emma, this machine says my heart rate is 80. Is that a normal heart rate?
Yes Mr. B. A heart rate is how many times your heart beats in 1 minute. A normal heart rate is 60 to 100 beats per minute. In the teaching role the nurse should identify a patient's learning needs and preferred method of learning. The nurse should find out what a patient already knows and expand on it. Mr. B, can you tell me what you know about high blood pressure?
Not much. Isn't it caused by eating too much salt?
Sodium which is found in salt can affect your blood pressure. I'd like to help you understand more about what is causing you to have high blood pressure. First, can you tell me what you do for a living?
Yes, I am a writer.
Oh, how wonderful. Does that mean you love reading?
Yes. I love to read.
Okay, great. I will give you a pamphlet on high blood pressure to read, then if you have any questions you can ask me. In the leadership role the patient looks to the nurse as a role model. Showing of interest and presence should be practiced. Encourage active participation. Keep in mind the patient is at risk of becoming dependent on the nurse. Use interventions to discourage this behavior. Mr. B, today our goal should be to get you out of bed and walking.
No, I don't think I want to do that. I am scared it will be too painful.
Mr. B, getting out of bed is an important part of your recovery. I will get you pain medicine and I will be back in an hour to help you walk.
Okay, before you leave can you turn the volume up on my TV?
The remote is sitting on your table. Please use it to turn up the volume. In the surrogate role the nurse may remind a patient of someone they know. The nurse could look like or act like that person. It could be a negative or positive relationship. If a patient mentions the nurse reminds them of someone they know, it is important the nurse addresses this. The nurse should tell the patient they are not that person.
Emma, this is my mom. Her name is Emily. She has always taken such good care of me. She's my hero. Wow Emma, I just realized how much you remind me of my mom.
Mr. B, you are right. Your mother and I have some similarities, however we are not the same person. She is your loved one and I am your nurse. In the counselor role the nurse helps a patient identify feelings they have surrounding their health. The nurse can help them identify and express negative feelings. In this role it is important to help the patient identify that their experience is an important life lesson. Mr. B, you're being discharged soon. Aren't you happy to go home?
I am scared that I won't be able to manage my high blood pressure at home. I am also worried about the side effects of my medicine and how they will affect my life.
It is good you are recognizing your feelings before leaving the hospital. You have learned a lot here. You can make positive life changes. Let's talk more about your feelings.